today because we have several of our committee members that are not here, including, I knew that Stuart and Susan weren't going to be able to be here. I thought Courtney was, but if she's not, I'm wondering if she could be in the hospital delivering since her due date is next week. So, but Mary Ann, why don't we go ahead with roll call. Do I have it here? Sorry.
Okay, so Shelley.
Present.
Susan's here. I'm Mary Ann Contreras. I'm present. Wayne Dennis.
Here.
And that's all I'm going to say.
Okay. So clearly we don't have a quorum today, and I don't think we were going to be voting on anything anyway. Next agenda item is recognize and welcome new members to the committee. Our new members will join the committee beginning with the February meeting. So we actually have 6 new members coming on, and they are Cassandra Dillon, and I know Cassandra is actually in the audience, so just wave your hand, Cassandra. We're welcoming you. Cassandra is one of our new members. Dr. Shenoy will also be joining the committee, and many of you may remember Dr. Shenoy was an active participant of GETAC, of the Injury Prevention Committee in the past, and so we will welcome him back. Dr. Mark Sparkman will be joining the committee. Sandra Williams will also be joining the committee, and then Mary Ann Contreras and Stuart Williams were both up for to be reappointed, and both of them were reappointed to the Injury Prevention Committee. So we're excited about that. Next on the agenda is to identify and list the accomplishments of this committee since its inception and report back to GETAC. So I have not been on the committee since its inception, and I know that Wayne and Mary Ann have both been active participants and attended GETAC meetings probably long before I was attending them and moved to Texas. But I think I'll just start it off, and Mary Ann and Wayne, if you have other things to add. In the last few years, I know that this committee developed a position statement on child passenger safety and booster seats for kids, and that was some material that was used when the booster seat bill got passed in 2009. We have, in terms of position statements, we have this committee also worked on this year another position statement on workforce development that will go for approval to the big GETAC committee on Monday evening. So those are 2 position statements that the committee has developed. The other thing is, I believe in the very early years of the committee, the group worked on trying to identify injury prevention programs that were available in the state of Texas, and actually there was a document listing all those programs several years ago. As usual, you know, things like that are kind of moving targets, and so somebody needs to be updating that all the time, and I don't think that has been updated recently. That's a big job and probably a full-time job for someone. The other thing that this committee has done over the last couple of years is develop documents based on the spectrum of prevention, and those spectrum of prevention documents are available on the GETAC website, and they're for different injury categories. So, and I'm not going to be able to name all of them, but there's one on concussions, there's one on impaired driving, there's one on teen driving, geriatric, older adult falls. So those are meant to provide programs with information about what are evidence-based strategies to prevent injuries for those particular topics. And it was a lot of work by the committee, and I think good documents to have. And then most recently, we spent 2014 developing the Hospital-Based Injury Prevention Components Guide, and this is based on 5 components that this committee, as well as representatives from TTAF and TTCF and the RAC, had input on, and these are components that are going to be recommended for hospital-based injury programs, regardless of whether they're a level 4 at a level 4 hospital or a level 1. And it's got some supporting materials in it, and again, the committee spent a lot of time working on it, and it's in draft form until Monday night when the big GETAC committee will vote on that in terms of whether or not they plan to endorse it. So, and here she is. We thought you might be at the hospital delivering. So, and Courtney, we were just going over, add her as attending, over the list of accomplishments for the committee, and I will provide that report to GETAC on Monday night. And do you all have anything else to add in terms of we talked about the spectrum of preventions that documents that we developed, the hospital-based injury components, the workforce development position statement, the booster seat or child passenger safety position statement that was passed several years ago. Are there others that you all can think of, other accomplishments for the committee?
Partnering and supporting with other professional organizations.
Absolutely, right.
ENA conference, TTCF.
Right. This committee over the last several years has had a real focus on workforce development and trying to enhance opportunities for injury and violence prevention professionals to obtain newest, latest, greatest information. So, any others, guys? Okay. Next on the agenda is Ebola virus disease recommendations, and I think this got put on every agenda just so that if there were comments and people wanted to discuss Ebola, I don't have anything to add. Do any of the committee members have anything to add regarding Ebola? Okay. Any public comment? Any comments from the state that they want to make?
No, I think it was just a general placeholder.
Okay, thanks, Colin. And then also on the agenda is acknowledgement of outgoing committee members. And as I said, Marianne and Stuart were both up to reapply for the committee, and both of them will be staying on the committee. And so at this point, we don't have any outgoing members. All right, Courtney, do you want to give us a TTAF and TTCF update?
Sure. So I'll start with TTCF, the Texas Trauma Coordinators Forum. They met yesterday, and what their committee has done some strong work with the Just Drive campaign. So they were really pushing that and talking about that and integrating with that. TTAF will be meeting tonight at 5:30. They are planning their biannual TTAF Injury Prevention Symposium. Is anticipated to occur in August, the Monday before the GETAC week. In August is where they're hoping to get that coordinated, and again, their structure of their it's a one-day education. The morning is more geared towards the knowledge basis, gathering some knowledge about injury prevention. I know the topics are going to be data management, coalition building, evaluation, and there's one more. And then the afternoon is demonstration of successful programs, where they will have examples of programs that people have implemented and done, coordinated together. So that will be again in August, and that's TTAF's Injury Prevention Symposium. So,
okay. Has TTAF developed their legislative or policy agenda for 2015?
The rough outline is created. They're focusing on nailing that down, getting that finalized. There's still a few question marks up in the air as to some of the areas that are going on, some of the bills that are getting pre-filed right now, and what's happening with that.
I know that there are a few bills that that are being planned that probably impact the injury community, and there's two that regarding texting and driving, House Bill 64 and I think House Bill 141, and I didn't. So those are two that are likely to be introduced. And then another one that we heard about was House Bill 166 that is, the plan is to exempt certain people from wearing their seatbelt as a result of a medical condition. And so I didn't know if TTAF had discussed any of those, if there was going to be
They're
okay.
They're going through the pre-filing, and I know Dinah's already watching some of the distracted driving ones.
Okay, so I know that there. I mean, did you give? And I may have missed this. When TTAF is doing their Hill Day, has that been set yet?
Yes, it is February 17th.
February 17th. This is an opportunity for groups and individuals and groups to show up on that day as a unified and coordinated front. And the distracted driving bills look to be based on some new good evaluation evidence showing that distracted driving laws are actually having an impact on reducing deaths and as a result of motor vehicle crashes and things like that. But I also think that if with House Bill 166, it's probably an opportunity for us to coalesce as an injury and violence community to say, you know, is this actually a good bill to exempt people for medical conditions? And so maybe that's an opportunity for us to visit with different groups as well. So, okay. Anything else?
Mm-mm.
Okay, thank you. Next on the agenda is discussion regarding state trauma reports. And I know that Dr. Chris Drucker is in the audience, and I'm not going to put you on the spot, Dr. Drucker, but in the past we have been asked to provide input regarding trauma reports that we would like to see. And so I think we'd like to just hear from the committee on certain types of reports, and Dr. Drucker is in the audience and so has an opportunity to provide feedback. And I actually visited with Dr. Drucker prior to the meeting, and he was informing me that the Trauma Registry Group is actually working on putting together injury indicator reports that CDC asked for 2012 data. So I think that's a great start, and would like to invite Dr. Drucker to present that information at the February meeting, so make sure that I get that on the agenda. But do you want to speak first, or do you?
I could go ahead unless, Courtney, you really want to jump in there?
Nope, go right ahead.
Okay.
Chris.
Also want to bring it to the attention of the committee that part of our fiscal year 15 objectives and activities with the grant that we received from TxDOT, there's a portion in there for data analytics and tools to be built within the registry itself. And so we're looking for ideas from stakeholders, from all the committees, to really come up with different reports that may benefit not a specific system, but the Texas as a whole that will be useful for EMS, for trauma community, for injury prevention work. And so that's one thing that we're asking all the committees at this GETAC to really communicate with us, and we'll reach out to the chairs and the committee members as well. We have a deadline on that activity by the end of January to just come up with the ideas as to the reports, and then by the end of April to actually implement such tools and reports into the registry so that they could be run for your facility.
Any questions or comments from the group in terms of reports we would like to request?
Well, the original 5 that we created.
And
Do you?
do you have access to that, Dr. Drucker?
So there's a common thing going around, I've noticed with all the committees, of all the forums. In regards to things that have been requested in the past, information may not have been shared with myself or with our current staff members. But I believe in regards to the 5 that you were talking about, Courtney, I think I have that information because I believe we completed 3 of those reports.
We have. One of the things that when we, and Liz sent us some information that we worked through at our last work group meeting. If there was a way that we could rate-based it, do it like per 100,000 of, to kind of give a better idea of what people might be seeing in their area.
Correct. So I actually had a meeting with the director of our Center of Health Statistics to talk a little bit about the trauma data too, because on CHS they have a query tool where some of our data is on there where you can go on, and if you just want to look at some really raw statistics on there, some quick things, you can go out there and pull the data. And one of the questions they had for us was, what are you guys using for rates? And right now we're determining what will be useful for the trauma community, what will be useful for the EMS community, all for injury prevention efforts. So we can look at stuff like hospitalizations at a RAC level, at a county level, so then you can really target, what is going on in your specific area. So we can do stuff like that. We can incorporate it into our reports.
Yeah, because I love the numbers, but I'm also kind of a numbers person, and I didn't get overwhelmed by it, but I could see very many people looking at that spreadsheet and going, oh my goodness.
Correct.
So Courtney,
Colin?
I just want to back what you were saying about the per 100,000 rate. That's most useful to us too.
So we could use that as our denominators.
Yeah.
And then with, also to just make it known to this committee, one of the issues that we've been working on with the registry is ability to accept data from facilities that have an XML file upload. And I just want to make it aware to the committee that this issue is currently resolved. However, it is part of a package of our new build, and there is some final testing going on in our new build. And we were hoping to have it ready for this GETAC, but there's one little error in our submission feedback report that we're trying to debug. And so once that gets completed in the next couple of weeks, we will let all members in the registry who have an email address know about the additions in this new production, in addition to holding a webinar where we will be able to talk with stakeholders about what's new in the registry. So now we could capture all this data that's been sitting there in a facility's own system that hasn't been able to be uploaded to the registry yet. And so we're anticipating to get quite a bit of records, which will ultimately change the way that our current data reports look like, which is just a subset of what is out there.
Okay. And I actually, I had told you that I will send you kind of a sample of some information that we've received in the past that we really liked, as well as, and I know Courtney's a numbers person, but I'm not. But she did a really good job of detailing the reports that we'd like to see, and I have your original email, so I can forward that to you, Dr. Drucker, next week as well.
And that'd be great. And I can't say if we'll have all the reports ready for next GETAC, but they will be priorities.
Okay.
Because the purpose of the data is not just to come to the state just to sit there. That's not the purpose of the data. The purpose of the data is so we can work with the data, massage the data, and then produce reports that can go back out to the community to improve the EMS and trauma care systems in the state of Texas. And so we're now at that point where we can actually start creating these reports and providing it back out. So we're excited to be able to do this and to be able to provide this information to try to prove the help.
Well, we're not going to require you to have them all ready for the February meeting.
Okay, great. Thank you.
Wayne or Marianne, do you have any comments or questions? Or are there, from the audience, are there reports that stakeholders would like to see in addition to probably the 5 that we requested? And there were
The 5 that we had originally requested, the first one revolved around mechanisms of injury. You know, what were the leading mechanisms of injury that was causing mortality? The other report was what is causing morbidity, what's causing the cost to be high for our trauma patients, and what's causing their length of stay, their injury severity scores to be high. Then we also had one specific to older adults, and older adult falls, and then one specific for pediatrics, and a drowning one.
Right.
Drowning was the last one.
See, I knew she was a numbers person. She actually remembers all that. Okay. Thank you for that. And we will put you on the agenda, and we'll have discussions between now and then as well. Put you on the agenda to do the injury indicators report update for the February meeting.
Thank you very much.
Thank you. Okay, next on the agenda is planning for 2015 Injury Prevention Committee activities. And I think the reason I put this on the agenda is because we had submitted, GETAC is in the process of updating the Texas EMS and Trauma Strategic Plan. So we had submitted updated, I guess, goals and objectives at the August meeting. And I actually do not have feedback from GETAC in terms of where we are on that. But I was thinking that we could talk about some of the, I mean, are there things that we want to do going forward based on some of those goals and objectives for this committee? And you all are thinking, I'm trying to remember exactly. What this committee did was structure our goals and recommendations around the spectrum of prevention. So there were some things that regarding policy, there were some things on making organizational changes, there were some things on, you know, continuing to foster relationships, coalitions with different stakeholder groups. There was something on educating providers and something on, you know, community education, as well as what were the things that we wanted to do regarding changing individual knowledge and skills. So would it be helpful, I mean, we can discuss that now, or would the committee prefer to wait until we hear feedback from GETAC as to whether those goals and objectives were approved, or what?
I think we kind of need to wait to get some feedback on that. But I also think that we're continuing to move forward with those objectives. We are already starting to see some of those pre-bills that are getting filed early before this session starts on January 13th. So we're already paying attention to that. We're being involved and focused and proactive in that regard. I know that there's the professional organizations that are going on that are reaching out for experts for us, and that we're also integrating ourselves in with that. And some of the ones that we wouldn't technically think of with the Carrie's group with the occupational health. So I think we're still in that aspect, really helping support TTAF's Just Drive campaign, getting that out in the community since they're really starting to see that program flourish and move forward. So I think, yes, we need to wait for GETAC to give us some feedback, but I think we're still moving in that direction.
I agree with Courtney. I agree with Courtney. I think we need to see if there's any other areas that they want us to look at, or if they're good with the way that we have structured our plan. So I think we just have to kind of wait for the go-ahead. Wayne?
I agree.
Okay. This is going to be a short meeting, guys. Okay, the next thing on the agenda is an update on the Injury Free Texas website, and if you could go ahead and pull that up. I think we discussed this and mentioned this at a previous Injury Prevention Committee meeting. This is something that the University of North Carolina Injury Prevention Research Center had some funding to do, so they created a website for the state of North Carolina. And they were hoping to do additional states, and Texas was first on their list after North Carolina's was done. There are, and this is supposed to be a place, kind of a one-stop shop where you can go to get best practice, evidence-based, evidence-informed policy strategies to prevent injuries and violence. It's divided by topic areas, and if you will click on injury topics, and click on transportation, and child passenger safety, it just pops up. So if you scroll down there, it lists what are the strategies that have been most effective in preventing childhood motor vehicle crash deaths and things like that. It also has resource links that you can go to. Most of them are Texas links because they wanted it to be specific to Texas, and it also has the resources. Now, if you could go to the page that is, so this is live right now. It's at injuryfreetexas.org. They have also put in placeholders for topics that have not been updated or developed yet. And so if you could go back to the top, to the injury topics. Yeah, go to suicide. That's one that's. So what you will see is this page has not been populated yet, but it does direct you to information like to the Suicide Prevention Resource Center that has some national information and things like that. So there's several sites or several pages that haven't been developed yet. Suicide is one of them, I think. Trying to think. Unintentional prescription drug poisonings is one that hasn't been developed yet. Older adult falls, I believe, but a lot of the traffic ones have been. So it's a website that we want you all to be aware of, and I will talk to Starla and others about adding this to the GETAC Injury Prevention Committee website so that people know it's there and can access it. Does anybody have any questions about it? The other thing is that I've sort of been tasked with keeping it up to date. So if you know of resources and things like that, please let me know because we'll want to make sure that this goes here. Under resources for prevention, a lot of the resources for the individual topic areas appear there, as well as they've also uploaded the Children's Hospital Association of Texas's childhood injury report that they, Brian Sperry, presented on at the August meeting. So that's available on this. So we want to make sure that this website stays updated and has the best information available for Texas. So this would be a place that we would put information regarding the TTAF, the TIP conference, and things like that as well. So, yes. And can you come to the microphone, please? Thanks.
We have, a large military population, and I'm assuming that there are plans to work with the PTSD and the military and our returning troops, because I know in El Paso, we're seeing a huge impact, and I'm sure that the folks around Fort Hood and any of the other military installations. But could you consider a link maybe to their injury prevention for the PTSD or treatment insights?
Absolutely. If you could just get that information, if you've got a card, or if you want to email me, we'll get that added. But
okay, be glad to. Thanks.
All right, thank you. Others? Okay, the last thing on the agenda was National Injury Prevention updates, and unfortunately Stuart couldn't be here today, but he has been serving on a coalition of hospitals, trauma surgeons, I can't remember the exact name of the coalition, and providing input to them because there's a lot of talk regarding new trauma curriculums that are being developed and available for hospital-based trauma or hospital-based injury programs. And I know Stuart was on a call with him on Friday. He did not get me a report. I don't know if you know
Marianne,
anything
you
else.
wanna? Okay. So, it's the Injury Prevention Coalition with the AAST is where Stuart's been participating, and he is participating in that group as a representative of Safe States Alliance. And what this group is looking at is trying to bring together all the various groups, Society of Trauma Nurses, Emergency Nurses Association, the AAST East, Safe States Alliance, SAVER, and bring them all together, and so that they're all kind of coalescing on the same page and the same agenda regarding trauma injury prevention. The American Trauma Society, ATS, has revised their National Injury Prevention course that they have typically offered. It's very similar to the Trauma Program Manager course, many of which have contributed to that. Marianne contributed to that course as well. It's a multi-effort. There are many people involved in writing in that from all different aspects, and it's looking to reside with ATS. That's still a tentative decision as to whether it's going to reside with ATS or STN, but it's looking that it's going to be ATS. And their first demonstration of this course is anticipated to be at the STN's annual conference this year in April, where they're going to debut the course and how it's going and flowing together. Lots of this is stemming from some of the changes in the Orange Book, where they're being a little more prescriptive in your injury prevention activities for the level 1s and 2s, wanting to see more outcomes, more evidence-informed, evidence-based processes in your injury prevention, more dedication, more required education for your injury prevention experts within your trauma centers, whatever that might be. So this is everyone still trying to feel everyone else out and get a gist of who's who and who's coming from where and what toys they're bringing to the sandbox is a lot of what's going on. But it's growing, and the fact that people are starting to listen and move together is very good. The injury prevention experts are starting to hear what trauma needs and how we look at things slightly different and what we're looking at. And the trauma peeps are playing into that public health model and understanding a little bit more of the public health approach, the community-based approach, and drilling down more specifically in that way. So there's a lot that's trying to be built and finessed together. So there's going to be a lot coming out of this oneness, I guess you could call it, in the future, and moving together with that.
It's like a commune for injury prevention people is what it is. And when I asked exactly where they were on the development process just a couple of weeks ago, I got the response that the ATS is still looking at everything and evaluating. So we're still kind of up in the air, but what's really cool about it is that trauma professional people are actually fishing upstream and looking at prevention very seriously, as seriously as they are their surgical techniques. So it's very nice.
Are there any questions or comments from the audience about that effort? Okay, it's time on the agenda for general public comment. Does anyone have anything to add? Colin?
Hi, I just wanted to let you know that there will be an annual report, probably the first one from our office since I've been there, coming out of our office, EMS and Trauma. Look for that in January-ish. That's really leading causes of injury and death in Texas, and it's not a white paper. It's more designed for outreach, and it's terms that the general citizen can understand and identify with. That's my goal. So.
Great, thank you very much for that. Mr. Christopher?
How are y'all? Hey, I just want to give you guys a heads up, something that's on the horizon up in our neck of the woods that we've been working on for about the last, 4 or 5 months, is up in East Texas, we do have a significant number of ATV crashes. And so what the Nacogdoches Child Fatality Review team bunch kind of gave birth to was the thought of teaming up with the Stephen F. Austin Cinematography Group and creating a video, an injury prevention video, if you will, or an educational video, if you will, that's targeted predominantly at adolescents, that age group, as far as ATV safety. And it's kind of it's about a 4 or 5 minute video. And I've seen the first rough draft. The final rough draft is supposed to be shared at that CFRT meeting in early December. And the thought process with that group is, or everybody that's been involved with that is to share that real widely. And to the point where if another RAC or another organization wants to take it and stamp it with their logo kind of deal, that would be permissible too. So there wouldn't be any playing it real close to the vest and this is mine and you can't have it without, you know, a cost or anything like that. Again, to share it real widely, even maybe put it up on YouTube or something, you know, so it's readily available. So get it out there. So that's on the horizon. Hopefully it'll be such that I can possibly maybe even display it at the February meetings if y'all would like to see it.
That'd be awesome.
That'd be great. And also, Scott, Amy Bailey, actually, who is the new State Fatality Child Review Team Coordinator, replaced Susan Rodriguez, was actually the Dallas County Child Death Review Coordinator, was in the pediatric meeting earlier, and she was talking about things that are on the horizon for the state child fatality. And you probably already made this news available to them, but I know that they're always looking for ways that they can highlight local fatality review teams who are using data and then using that data to develop something.
Right.
So
hopefully make a difference.
okay, thank you. Marianne, did you have something?
Shelley mentioned earlier about, Courtney, about the Day at the Hill, and Shelley mentioned it, that TTAF puts together, and I would really encourage you all to consider going to this. If you don't get to get out of town a whole lot, this would be the meeting to go to. It makes a big impact of representation of trauma professionals at our Capitol. You are welcome to bring people that can speak to your representatives, people being patients, people that have been affected by trauma with positive outcomes or not positive outcomes, but just to come with a voice of unity that we are doing the best that we can in our state to prevent injuries, to treat them properly, and we have a phenomenal trauma system and it needs to be strengthened. So I really encourage you to consider that trip and consider even contacting your representatives now to make appointments. It's not hard and they really do want to listen to what you have to say.
Thanks, Marianne.
I'm Sally Snow from Cook Children's. Marianne reminded me of something when she said legislature. Yesterday on our EMS for Children Advisory Council meeting, we learned from Brian Sperry at Chat that Representative Tom Craddock from Midland plans to introduce a bill to make it a law against texting and driving in Texas. And Chat is helping him organize some potential families or people who have been affected by texting and driving. And so we're trying to funnel that information through Brian at Chat. So if anybody knows of anyone, please let Brian know about that. And another thing I wanted to bring to your attention is, at Cook Children's, our injury prevention team has been partnering with the Fort Worth Fire Department and the Fort Worth Fire Department charities, and we have had a very successful campaign to get kids to wear bike helmets, and we had 30 firefighters from Fort Worth Fire Department go through our volunteer training at the hospital. And so when we have a kid who's injured on a bike or an ATV that needs a helmet, the firefighters come up and take the helmet to the child's room and talk to them about it, and it's been very impactful for the kids to hear from the firefighters that, you know, we would never think about going to our job without a helmet, so you need to be wearing your helmet when you bike or on an ATV, and they help us with car seats and personal flotation devices, and it's been a very successful coalition. It's called Peaks and Badges, and it's been very successful. So,
Okay, thanks,
anybody
Sally.
who'd like to hear about it, let me know.
All right, thank you. Any other public comment? Announcements? I actually have one, and Courtney reminded me when she was talking about our attempt to work with groups to do workforce development and things like that. The National Safety Council has, unbeknownst to me, unfortunately, but has evidently does a national, or not a national, but a Texas state conference every year. And this year, in conjunction with that conference, they are actually planning a workshop for community-based organizations. And it is, the dates for it are, when I just wrote it down, March the 29th and the 30th. And they are, there will be a slight fee, and I can't remember, I think it was under $100. It's being planned very quickly. But we'll make sure, and I know very little about it at this point, other than I've been asked to speak, and I think Courtney has, and Mary Ann's been asked to contribute as well. But we'll make that information available on the GETAC website as well when we know more about it in terms of dates, cost, registration, and things like that. Anybody else have announcements or? Okay. Next is review and list agenda items for the next meeting. And Mary Ann, I think you got some of those. We'd like to hear from Dr. Drucker's group on the injury indicators. We will keep, let's go ahead and put the National Injury Prevention Coalition activities that Stuart has been doing so that we can hear updates about that. Let's also probably try and get some information back from GETAC regarding the strategic plan, and we'll go ahead and put planning for 2015 on the agenda again, as well as was one other thing. Can't remember. That's the other thing that we probably also need to talk about is workday meetings. In the past, we've had workday meetings. We've scheduled workday meetings the month before the GETAC meeting. So why don't we go ahead and schedule those, get those dates on the calendar. I think what we've tried to do in the past is the last Friday of the month before. So, and we can determine locations later. So that would be January 30th, sorry. April 24th. July 31st. And October 30th. Okay. Any final comments from the group? We will welcome 6 new members to the February meeting. If not, we will adjourn. Thank you.